One of the organizations that I am signed up to is the VIIV Healthcare. I follow this page on Facebook. I am also in the mailing list, right? You can simply register on their internet interface on their page to subscribe to the updates that they might have for you, right? So in August, actually, I received this email on Tuesday, the 20th of August, and I am reading it today, which is Wednesday, the 21st of August, right? 2024. This is the heading here is the pulse. I'm going to read. Since the early years of the HIV epidemic, the US South has been especially hard hit, with communities of color bearing the toughest burden. The South is home to the majority of people living with HIV and new cases nationwide, with almost half of diagnoses each year being made in this region. As the only company solely focused on HIV, we know it's about more than just medication. It requires courage, creativity, and collaboration. Our commitment to communities and organizations in the South drives our innovative work and positive action programming. I quote, VIVV's response to the evolving HIV/AIDS landscape is bringing this challenge out of the shadows and into the national spotlight in places where the need is greatest, says Mark Meacham, VIIV's head of external affairs in North America. The data is clear that the South is where HIV diagnosis rates and treatment disparities are highest. We're partnering with community organizations in the South, united in our mission of ending the epidemic by educating and assisting their neighbors. Since we began in 2010, Viv Healthcare has been committed to disrupting disparities in HIV hand in hand with community in the South, providing over 80 million funding to 300 plus community-based organizations across 110 cities. Through major initiatives like our Positive Action AMP grant, we're focused on uplifting new voices and supporting grassroots leaders who are making change, such as take Leisha McKinley Beach, who is overviewing the Project Share, and Josh McCauley, who's overviewing Teen Health Mississippi, for example. These are two AMP grantees who are doing courageous work in the South. And if you click on these, you will get to hear from these two particular projects and these two particular advocates and what they are doing, right? So this is on the VIV Healthcare. And I think what I like most important about this particular email and this particular article titled The Pulse is how they explain what advocacy is. So I read from the VIIV Healthcare page. This is what they have to say about advocacy. Advocacy is love, a beautiful anger channeled to create the world we deserve. VIIV Healthcare has a deep and long-standing commitment to ensuring that HIV is a public health priority in the South. Project Disrupt, or Makers of the Movement, is an immersive experience where you will not only hear from the makers of these movements, but you will be invited to embark on a personal journey from awareness, empathy, and ultimately to take action and accountability. This is led by Ken Williams, Dr. Michael Everett, and Britt Barton. Project Disrupt seeks to challenge, inspire, and reignite the movement makers in us all. How appropriate. I love that. I love how they describe advocacy is love. It is a beautiful anger channeled to create the world we deserve. I love that. I love how they said this.